right, Isabel. Welcome back to the office. Thank you, as always, for coming in. So, good. Strategically placing this in between the small joints of your spine. I have you scheduled today for another back examination, and as far as I could tell from my notes, it looks like this is just a follow-up assessment because you were having a little bit of discomfort in the muscles of your back. So I did want to have you in to just have a little bit of a look and make sure that you didn't injure yourself. This should be more of a brief assessment because we did perform your in-depth back assessment not that long ago. So the good news is that I shouldn't have you in here for too long today, but I do want to go ahead and have a look to make sure that there's nothing more serious going on. So what I'm going to do is start by just clipping your hair out of the way slightly here. So let me just relax for me. I'm just going to make sure that your neck is exposed so that I can better diagnose you. Of course, making sure that I have good visualization of all of the areas. So I'm just going to use this clip here to gently clip your hair out of the way to ensure that it doesn't impede my vision. Okay, so I'm going to go ahead and start by having kind of a visual inspection of the overall integrity of your back, looking at your muscular skeletal kind of framing here, making sure that there are no signs of asymmetry and nothing that is more obvious on the external level that you might have injured yourself. So having a look at your back as a whole, noticing any signs of misalignment here. I'm seeing maybe a slight indentation that I will have a little bit of a better look at. So I think what I'm going to do is just begin by undoing your top, if that's okay. So I'm just going to go ahead and expose your back here. Okay, so without exposing too much, I'm just gonna tuck this in to your pants here. So I will go ahead and have a look at the overall structure of your back and just having a look with my Penlight. So the indentation that I see on this side, I am also seeing here, so that's a good indication that that isn't an abnormality, more so just a natural formation of your bone structure. Also seeing normal curvature of the waistline as well as a very normal and healthy dip in your lower back. So again, for today's visit, we're more so going over the overall structure of your back, looking for any signs of injury. So all of that, as far as I can tell, does appear to be normal. So I'm going to go in with some initial palpations and just feeling around for any possible abnormalities in the structural integrity here. So starting with this area. And then moving up to the kind of mid-back region. Okay, and then having a look at the scapula and back shoulder area. Not noting any abnormalities here. So moving laterally right to left. So the good news is that so far I'm not seeing anything that could indicate a sign of kind of a more obvious injury to your back. So I think that we are okay there. So I'm going to go ahead and close your top now that I've had a look at the structure as a whole. Okay, and we can go ahead and move on with the remainder of the examination. So what I would like to do at this time is take a couple brief measurements for symmetry, again looking for any signs of abnormality from one side to the other. So my biggest concern would be any signs of inflammation or anything that could indicate that you may have injured part of your skeletal system or the vertebrae in your back, or even maybe a muscle strain, something that could indicate inflammation. So I'm just going to take a couple brief measurements here, starting on the right side. So far not noting anything. Okay. So I'm going to be taking my arc ruler here, and I'm going to use this to measure the curvature of your lower back. So starting at kind of the lower hip bone area. And looking for any signs of asymmetry or any cause for concern here. So we often see injuries in the lower back area, specifically noted to poor body mechanics. So it is possible that you may have injured yourself inadvertently. So just noting any possible abnormalities in the curvature of your lower back. But so far it does appear to be normal. I'm not noting any more flaccid areas in the muscle. It does all appear to be well intact. So if I turn my ruler vertically, not noting any asymmetry here either, which is good news. So using this again to measure the scapula, noting possible signs of abnormality here. That does appear to be normal as well. Okay. Okay, so I do want to go ahead and perform some percussions of some very specific areas. So I'm going to start with this area here. Okay. And I'm going to percuss directly along the spine. And I want you to let me know if at any point this causes you any pain or discomfort, or if you maybe just feel anything that feels abnormal and different from your last examination. Okay, so I'm going to do that directly on the spine now, just performing some very gentle percussions here. Just looking for any notable difference. Is any of this causing you any pain? Okay, good. Perfect. Okay. So I do want to go in with my tool here, and I'm just going to use this to have a look at the kind of overall skin integrity as well as the muscle tone in this area. So just using this to rule out any possible signs of inflammation as well as any possible abnormalities from one side to the other. So okay, so the lower back appears to be okay there. So essentially performing the same tests on these kind of smaller divots in the scapula here, looking for any notable signs of abnormality bilaterally, which I'm not noting. So I'm also going to run this along the top of the spine here. No notable differences there. And if I use the smaller end here to do the same thing on a smaller scale, I'm also not noting any abnormalities in skin texture, no signs of inflammation, or any abnormality in your muscle tone, which is good. Placing this back in the sleeve so it can be properly disposed of. So what I'm going to do now is use a different hammer to percuss along your kind of upper hip area here, and this is just going to allow me to produce a bit of a deeper percussion. Just applying a firm but gentle pressure along the top of the gluteal region, looking for any signs of pain or discomfort here, anything that can indicate an injury along your tailbone or otherwise that I'm not noting. Okay. So far, there's nothing that I can tell is abnormal, so I'm going to go in with an acupressure tool here and apply very specific pressure to certain areas, and I'd like you to just indicate whether or not any of this causes you any pain or otherwise provides any relief. So strategically placing this in between the small joints of your spine. Okay, as well as along those scapular indentations that I talked about earlier. Okay, performing the same thing on your lower spine here. And then alternating with a more gentle pressure. So what I'm going to do now is use the other side of this tool and just going to further rule out any signs of injury here. Okay. So all of that does appear to be normal. And I believe the last thing I want to do to further rule out any signs of injury is just do a very brief test for neurological response here. So there's no indication that you need to provide. I do just want to make sure that you've not injured any of your sensory components of your back. So just producing a very specific sensation here, and I'm looking for a normal reaction, and I am seeing that muscle response here. Good. As well as seeing a healthy response in the lower back. Any difference in sensation here versus here? This should all feel the same. Good. Okay. So performing some bone conduction, just producing a vibratory response on your spine. Perfect, okay. Okay, so just a couple more brief things here. And again, testing for that normal neurological response, which is clearly indicated there, as well as there. Well, just a couple more tests here. We're almost done with your examination. I am not noting any signs of injury so far. Good. Okay. So the very last thing I'm going to do is test your muscular response to soft stimuli. So I have two very soft tools here that I'll be using to essentially perform the same thing. And again, just looking for that normal response. Good. Getting a healthy response there. Okay. Okay, well the good news, Isabel, is that it doesn't appear that you've injured yourself. So I would just try to be a little bit more cognizant of your use of proper body mechanics. So what you want to do when you're performing certain exercises or just even everyday movements is making sure that you're engaging your core. So a strong core is the foundation of every movement of your body. So it helps, and a strong trunk is what's going to help make sure that you're not injuring your shoulders as well as your back, specifically your lower back. So make sure that you're engaging your core as well as bending at the knees. And of course, you want to lift with your legs, making sure that you're engaging your hips, tall back, and then you bend with your knees. And then try not to hunch over or bend with your back. We always want to keep a straighter back, tall shoulders. So almost imagine as if someone is pulling you from the top of your head and then pushing in on your lower back, tall shoulders, and then you bend at the knees, and that's going to help you from keeping to injure yourself specifically in this area, okay? All right, so as far as your injury assessment, I would say you are in the clear, which is good news. So I will go ahead and keep your regularly scheduled appointment, and in that appointment I will reassess, make sure that there's nothing that has changed, but for now I would say you are good to go, okay? Thank you so much for coming into the clinic today.
Thank you.
All right, have a good evening.